What sensations to expect after orchiectomy for testicular cancer? After undergoing an orchiectomy, which involves the surgical removal of one or both testicles primarily to treat testicular cancer, patients may experience a variety of sensations and changes during their recovery period. Initially, it is common to feel mild to moderate pain or discomfort in the groin and scrotum area. This discomfort typically lasts for several days to about a week or more after the surgery. Pain management is often provided through prescribed medications to help ease this discomfort. Swelling in the scrotum is another typical sensation following the procedure. This swelling can last from 2 to 4 weeks. Bruising around the groin and scrotal area is also common and may persist for a couple of weeks. In some cases, blood may collect under the skin near the incision, forming a hematoma. This can cause localized pain, swelling, and hardness, but it usually resolves on its own. However, if it worsens or causes significant discomfort, it is important to report it to a healthcare provider. As the surgical wound heals, patients may notice sensations such as tightness, itchiness, or numbness. The stitches used in the procedure are often dissolvable and can take up to 2 weeks or longer to fully dissolve. Some individuals may feel mild pulling or tugging sensations as the incision continues to heal. It is also possible to experience changes in sensation, including some loss of feeling or numbness in the scrotal area due to nerve disruption during surgery. While this is usually temporary, it should be monitored, especially if accompanied by severe pain or other concerning symptoms. Fatigue is another common experience post-surgery, with many patients feeling tired and having low energy levels for several weeks. Full recovery can take anywhere from several weeks to a few months, depending on individual health and whether additional treatments are necessary. If both testicles are removed, patients may experience hormonal changes due to the sudden drop in testosterone levels. Symptoms may include hot flashes, sweating, decreased sex drive, difficulty achieving erections, mood changes, and potential weight gain. These effects typically develop over weeks after surgery and should be discussed with a healthcare provider for appropriate management options. Emotional and psychological effects are also important to consider. Patients may experience feelings of anxiety, fear, sadness, or changes in body image. These reactions are normal following major surgery and cancer treatment. Support from healthcare professionals, counselors, or support groups can be very beneficial during this time. Lastly, activity restrictions are advised to promote healing. Patients should avoid heavy lifting, strenuous exercise, and straining during bowel movements for several weeks after surgery to reduce the risk of complications. In summary, after an orchiectomy for testicular cancer, patients can expect localized pain, swelling, bruising, and various sensations as the surgical site heals. Hormonal changes and emotional impacts may also occur, especially if both testicles are removed. Maintaining close communication with healthcare providers is essential to effectively manage symptoms and support recovery.